Chronology of teeth and young permanent teeth. So what is basically chronology? Chronology consists of two words, that is chronos and logos. Chronos means the sequence or the series, and logos means the study. So chronology is basically the study of various eruption types of and shedding the root development of various teeth like the primary teeth and the permanent teeth in the oral cavity. As it is said that there is two type of ages of the children, that is dental age and the chronological age. Dental age is the age which corresponds to the timing of the last tooth erupted of the child, and the chronological age is the age of exact age of the child. So there is various sequence of eruption of various teeth in the oral cavity. Like in primary teeth, the central incisor, which is the lower central incisors, will erupt first, then the lateral incisors, then the upper central and the lateral incisors, then comes the mandibular first molar and the maxillary first molar, the canine, the second molar. So this was the sequence of the eruption of the primary teeth, where the various eruption times are: the maxillary teeth are from 6 to 7, the mandibular teeth are also from 6 to 7, and the first lateral incisor is from 8 to 9. So further sequence is followed for the eruption of teeth, which is the primary teeth. So after the eruption of the teeth, the root formation takes 1 to 3 years in between in the completion. So there is certain primary dentation period and the mixed dentation period. In the mixed dentation period, the first molar arises and the last tooth of the mixed dentation period exfoliate between 11 to 13 years of age. So this is a particular chronology of the permanent teeth, in which we can see that the first molar, permanent molar, erupts first around the 6 to 7 years of age. So here we can see the chart which denotes the initial calcification, the crown completion and the root completion of the various teeth. So what is the importance of the chronology? The main importance of the chronology of the teeth is to assess the growth of the child, the development of the child, if there is any developmental anomaly in the children or teeth. We can also help in knowing the age of the child by the means of the chronology, and the communication of the teeth is possible by means of knowing the chronology of the child. So what is the importance of young permanent teeth? The young permanent teeth have mamelons, which are development from various lobes of the teeth. For example, central incisors have 3 lobes, so they will have 3 mamelons. Then comes the open incisors or the open apices or the blunderbuss canal in the young permanent teeth. So the infection chances in the young permanent teeth will be very high because of the wide open apex. There will be increased blood circuli. Likewise, the healing of the young permanent teeth and the immunity of the young permanent teeth will be more than that of the primary or the permanent teeth. It will be easily remineralizable and will have cannon shaped or blunderbuss canal. That is, the shape of the root canals will be parallel or the walls will be parallel and the canal will be very wide. So this was the importance of the chronology and the chronology of the primary and the permanent teeth, and the importance of the young permanent teeth. Thank you. School dental health program. Now, school dental health plays a very vital and important role in education of children. All children are like raw mud. So whatever is taught to the children during very young ages is grasped or engraved in the mind of children. So what are the aims and objectives of such program? The main aim is to teach the children the proper or regular importance of oral health care, then also care of general health. It also aims in teaching the pupil, the parents and the caregivers in the importance of oral health and counseling of the parents. Then identification of any handicapped children and treatment and proper dental care of those handicapped children. Then identification and treatment of any emergencies. Then treatment and identification of any pathologies at an early stage, so that their treatment can be performed easily and to a less invasive level. So there are various types of examinations which are carried out at the school dental health level. First is a complete dental examination, then is a partial dental examination, then is examination by the means of the mouth mirror, the explorer, the probe, and the other dental instruments in the proper illumination. Next is the examination by just by means of the mirror and the tongue depressor in natural daylight. So these were various proper investigations or examinations which are done at the school dental health program level. So what are the various programs of the school dental health? They are the fluoride program, the community or the school water fluoridation, and the fluoride tablet program, in which the child is asked to take the tablet of fluoride in the mouth and swallow it, or sometimes also swish and spit it. Then there is a fluoride mouth rinsing program. Then there is a combination of the fluoride tablet program with the fluoride mouth rinsing program, or sometimes pit and fissure sealant to seal the harbor of the bacteria, which is the pit and the fissures at the school level. Then there is sometimes a combination of the pit and fissure sealant program along with the fluoride program. Now, what are the various types of school dental health program? First is the learning about oral health. Next is the tattle tooth program, the tooth keeper program, and school-based reliable health modification program. So let's come to learning about oral health program. So in this program, various children group are divided from kindergarten to grade 3 to grade 6, and 7 to 9, and 10 to 12. These are the various stages or level in which the groups are divided, and individually tooth care provider will take care of these individual levels. And if there is, after the oral screening, if there is any peculiarity or any pathology which is found in the tooth of the children, it will be reported and evaluated, and the children will be taught proper dental care methods and prevention of the dental caries, and the treatment of the dental caries is also done at the various level. Then comes the tooth keeper program. In the tooth keeper program, the elementary school teachers play a major role. Even along with these school teachers, a dental health professional is involved in training and teaching the child the importance of proper oral health. So this study, the pilot study, was done in Texas, and it includes children from kindergarten to grade 6. So this study involves the use of various flow charts, the various diagrams, the various posters, and even e-learning in learning the various oral health maintenance strategies and keeping proper oral hygiene by the children. So all these philosophies and measures are taught to the children by the elementary school teacher and even the dental health care provider, and the program evaluation is done in 16 weeks, and the patient hygiene score performance is obtained. The cost of the material will be depending on the number of the students, the classrooms, the teachers, etc. So next comes the tattle tooth program. In the tattle tooth program, the government health organizations are also involved along with the school teacher and the dental professional or the dental expert. So this involves the Texas Education Agency, the Texas Health Professional Organization, and the Department of the Health Resources. The main physiological roles is to prevent any occurrence of the dental caries and maintenance of proper oral hygiene by children. So the program implementation is done by a team of 16 hygienists and the Texas Oral Health Organization, the Texas Education Agency, the elementary school teachers, and even the children are involved. The teacher demonstrates the brushing and the flossing procedure to the children in groups, and the children by the means of some audio visual aids, and the children easily learn or grasp these procedures. So a dental health evaluation is also done at various levels, and it was found It is a decrease in the caries level by 15 to 80% by the teacher's evaluation method. Next comes the THETA program. Now, the THETA program involves US Public Health Services also. It involves the goals of qualified using a qualified dental health professional and use of high school students, elementary school teachers, and preventive practices, and involves the parents also. So in this program there is no formal evaluated mechanism, and even a questionnaire is asked. Next comes the school-based desirable health behavior modification program. In such program, a school health educator is also there, or the behavior modifier or the person who monitors the behavior of children is present along with the school teacher and the healthcare professional, the dentist, the oral hygienist, and the elementary school students and teachers. So a behavior modifier, he is an expert in handling the behavior of children and making them learn importance of good oral health care by the means of various behavior modification techniques and measures. So in a total class, if the class is performing well, they are generally reinforce the proper behavior by the means of reward system, and sometimes even the mother is also rewarded because the mother is underlying the teaching procedures of the children also. So the mother is also awarded, and the effectiveness is like it is judged by the means of a medical society, a local society, the parents and the teachers' cooperation. Now comes the tutorial program. In such program, the peer teaching is encouraged, like the 5th and the 6th grade children will teach a lower grade students the importance of proper oral hygiene, which will be further monitored by teachers and various healthcare professionals. So an organizing team or entire team works and all the interested students are signed up and their names are taken. There is a location of elementary school and implementation of the program and analysis of the results of the program by repeated screening procedures. The screening procedures is done 1 week before the program and 1 week after the program, and there is a written score pre-test and post-test score is maintained of the students, and the plaque score is also maintained. Then comes the ASCOP dental program. The ASCOP was a farming society in which there was a high level of dental caries. There was no water fluoridation, but the implementation of proper topical fluoride application was done in such society. There was a high caries incidence in the society, and later, after 10 years of implementation of the topical fluoride treatment as such program, there was a further reduction in the caries of 28% between 3 to 5, 36% from 6 to 12, and 14% from 13 to 17 years of age. Then comes the incremental dental care, is that there's a treatment of the children or accumulated dental needs of the children in particular increments, so that all the dental diseases are diagnosed and treated completely. So this is a periodic care and it is the ideal pattern of care. So there will be no accumulation of the dental needs in the children, and the dental caries and the periodic periodontal diseases will also be reduced. The main advantage of the system was that the prevention and the control was done at an early level. There was not running out of funds, and there was no migration of children and students in between. The disadvantage is that operative procedure is time consuming, because it will attend to each and every needs of the child, and sometimes the resources may be exhausted. Then comes the National Preventive Dentistry Program. It was generally a controversial program. It belongs to a classroom lesson of brushing and flossing of teeth. Significant effects of decayed, missing and filled teeth was found between 4 years of age. It led to improving in overall hygiene and imparting of the necessary skills and habit to the children. Now, there were certain school dental health programs, but they are also the limitations of the same. The limitations are the unavailability of the funds to the children, the proper combating of dental diseases was not there, and the training of the children was not taken as a responsibility by the school, and there is a failure of the dental professional to identify and treat the emergencies, and the preventive level or the preventive strategies involved a little support by the school authorities. Thank you.